concept of organ-sparing resection is to say that we want to develop ways to remove tissue and in lesions in which local resection, meaning just removal of that tissue, is enough to be curative. And we want to do it in a way that actually spares organs so that we don't have to make anastomoses and cut out entire parts of an organ, whether it be the esophagus, the stomach, or the colon. And so the concept behind organ-sparing resection techniques is really just to find ways to do that. And means either removing tissue without removing the entire thickness of a tissue so that you never run into the problem of breaking the integrity of a lumen or a wall, and the subsequent more complications or morbidities that are associated with it, such as infection and bleeding and leaks. Or it means actually finding ways to remove the entire thickness of that wall, in fact, which in situations where it's okay to do that, but to safely close that space so that these subsequent issues don't arise, and you have in fact spared essentially that organ. Some unmet needs that we have really are centered around various sort of larger topics. One is just in terms of recognizing the need for these type of techniques and not sending patients with benign lesions for large surgeries, which is kind of a pattern that we're seeing is actually starting to happen in this country, where, for example, benign polyps of the colon are being sent for surgical resection. And that, in today's day, with these new techniques that we have available, such as ESD, EMR, ESD, full thickness resection, should just not have to happen. And so part of it is recognition on the part of patients, on the part of providers to refer these patients on for more advanced endoscopic resection techniques. Another issue comes into just recognizing when it's okay to do that. So when a lesion isn't going to be more invasive and require a more complex oncologic surgery, but can be removed endoscopically. Another area where So in that sense, we have to really do a better job of training people to recognize patterns. We have to, ideally, we make this a more automated process, a digital process where artificial intelligence is involved, so we don't have to think so much on the spot, but these decisions we're assisted in making these decisions. We also need help with our tools. So it's hard to convince a physician, a provider who's got to learn a new technique, to learn that technique if it's going to take so long, and if there's high risks associated with it, such as bleeding or perforation. It's hard to get those physicians to really, buy into the concept. So one of the things we need to do is to say, we have ways to make it a faster procedure, a safer procedure, a packaged device, a procedure that has a package for you. You can open that. It has everything that you need in it, and it's a quick procedure to achieve this concept of curative resection. And so those devices aren't necessarily out there yet, and that's kind of the need that we have from industry, as well as physician inventors, I would say, just to come up with these devices. Another area where we're really challenged is, understanding the value of what we're doing. We're essentially doing a surgical equivalent. We're doing a curative resection, but we're doing it with less hospital stay, less complications, less cost. But the value given back to it by things like reimbursement, RVUs are not there yet. They're not recognized, and what we hear from payers and regulatory is that it's going to require these trials, comparative trials, randomized trials, and particularly in this country, that's just something that's going to be very difficult to achieve given the numbers involved, and so we have to find some balance of recognizing what's already out there in terms of the data, perhaps worldwide, where these techniques started, and accepting that into our thinking about how to change our reimbursement system and really changing the culture what is the value of being able to offer these types of techniques and really improve patient outcomes. So the timeline, I think, for this concept of happening somewhat will just depend on societal acceptance of these principles, but I think things are already in place, such as artificial intelligence. I think that's a rapidly growing field, and that's so that I think is already there. I think that companies are already thinking about devices, and we have some in place where we're not just thinking of individual tools, we're actually thinking more of systems and platforms. The biggest hurdle is going to come down to finding ways to reimburse and really make this an acceptable part of our practice. But I don't think it's that far away, and I think we have to maybe just change the way we approach it. And I think we'll get there, hopefully, within the next 5 years.